Welcome to the Living Medicine podcast, where we talk about ethical medical use of psychedelic psychotherapy, teaching skills, examining the issues, and interviewing interesting people. Now let's start today's show.
Hi, everybody. This is Dr. Sandy Newis with the Living Medicine Institute, and we are here at the Living Medicine podcast. And Living Medicine podcast is where we interview interesting people who are focused on the psychedelic assisted psychotherapy space. And it is sponsored by Living Medicine Institute, which is a business that provides resources and content and training for clinical and medical professionals who are interested in psychedelic assisted psychotherapy with a specialization in ketamine and ketamine-assisted psychotherapy. So I am excited today to have Shiva Thorsell and Rutger Engels, and they're both in the Netherlands. So just to introduce Shiva, she lives and works in the Netherlands. She's a clinical psychologist with over 25 years of experience in specialized mental health care. In addition to her clinical work, she does teaching and supervising for postgraduate training for health psychologists. She is very well trained in a variety of different approaches that are trauma focused, such as sensorimotor psychotherapy, body-oriented mentalizing, which is probably a European thing. I don't know what that means, and acceptance and commitment therapy, along with ketamine-assisted psychotherapy. And Dr. Rutger Engels is an award-winning full professor in developmental psychopathology at the Erasmus University in Rotterdam. And he is also a number of a variety of different businesses and startups. He is co-founder and director of a specialized mental health care, Senz, which Shiva is also one of the founding members in the Netherlands, and co-founded Orfeo Health, a San Francisco-based mental health startup. And what I know, just in summary, because Dr. Engels sent me this very long bio, is he's extremely well published. He's a distinguished professor. He has been what is the equivalent of the president, which is Rector Magnificus, which is just like so great in the US. It's like, and the equivalent to the president in the US system of the Erasmus University in Rotterdam. And he is well published and also very focused on the research side and the data-driven side, and has a business bent. So I am excited to have you all. I had the privilege to meet you all because you've been part of the Living Medicine Institute training program, and we've had the opportunity to do some collaborations. And so I'm just really excited to have you here. You are our first European guest. So that's a really interesting perspective, like the US and Europe, and specifically the Netherlands. So first of all, before we get into that, is there anything that you all would like to add? So Shiva, anything you want to add to your bio? Did I miss anything?
I think that is just fine. Yeah.
Good. Good. How about you, Rutger?
No, and in general, academics have really long bios, so apparently it's part of their species. So I think mine is acceptable.
Yours, right? No, I mean, compared to other
I'm
academics,
kidding.
it's just like right. It follows kind of a formal sort of thing, but but one of the things that I am really excited about is just when we'll get into that in a minute, but just, what I understand and why what I think what is exciting for people to hear about is that you all have launched a multidisciplinary clinic in Europe that is moving towards incorporating CAP. And there's a regulatory piece and a development piece and a lot of different pieces that I look forward to talking about. So I know what you're doing is really, really excited. So we'll get to that in a minute, but first of all, Shiva, how did you get into the field and what excites you about this?
Yeah. Good question. Yeah, I was not sure where it started, really started. Maybe it started with growing up with hippie parents. I'm not sure, but yeah, I guess about 7-8 years ago, I started hearing more about psychedelics and reading about it, and had colleagues and friends who had experiences, and it really kind of piqued my interest. And I thought, this is something I want to know more about. And so I dove into it and spent a couple of years quite intensely, reading and experiencing and learning. And I think for me, it really fitted what I was already feeling and thinking and working with a lot with mindfulness, compassion, attachment theory. So I think it all kind of, it's it felt like maybe not a missing link, but definitely added something to my understanding of, I guess, the struggles of human beings.
Yeah, nice. And I love that you're holding that lens up just for, it's kind of the integration and the intersection and the synergy with different types of psychological theory. So
Yeah, those are good words, synergy and integration. Yeah.
yeah. Good. How about you, Rutger? How did you get into this kind of, this being kind of the broad psychedelic field, recognizing that your clinic is not exclusively a psychedelic clinic, but
No,
just,
true.
yeah.
So, thank you for being on the podcast. I'm glad we could make it work.
Yeah, I'm glad to have you.
Yeah, and so about more than 4 years ago, let's go back. My background is in developing prevention and treatment programs for mental health issues, both for young people. That's how I started, but also for adults. And about a little bit more than 4 years ago, and I'm relatively late, I realized I started to read and talk about psychedelics. And then I thought, oh, wow, that could be really a facilitator of the treatment process for people who are really struggling and have all kind of persistent or chronic mental health issues. And so I joined a startup. I was asked to join a startup in Canada that was focusing on psilocybin, and I was responsible for developing the treatment program around that. Well, that startup they didn't go through, but I was so energized about the topic, I decided to set up a clinic in the Netherlands where we treat people, but also do research, and research is an integral part of the clinic. That was 2.5 years ago. That's also in the time I met Shiva, and it took us about 2.5 years to get it started, and now we really started.
Can I just name like 2.5 years is actually not that long for like a start, like an idea to like an implementation and opening the doors. So congratulations. It might seem like a long time to you, but to me, I'm like, wow, that's a lot.
Yeah. So patience is not a virtue I have. So for 2.5 years, still, it feels quite long for me. But
I'm
we
sure.
are here. So and it's complex to set it up.
Good. Yeah. Well, so let's talk about Senz. Is that the right way to say it? Senz. Just first of all, tell me how it is, and then just, what makes it unique. So Chibi, you want to start with that? And
Sure. Yeah, I think we have quite many unique selling points. One of them is, I think, the building and the surroundings. You can see it a little bit behind Rutger, how beautiful it is. It's been a very, very green surroundings, and that is definitely a conscious choice. We think it's very important, where you are and how the environment is, the healing environment. So I think that's quite unique for mental health to be in a beautiful place. That if you look at mental health generally in Holland or in the Netherlands, it doesn't look that beautiful always. So that's unique, and we have a team of now about 15 people, and we work multidisciplinary. So we really have different types of therapy. So we have, of course, a psychiatrist, we have several psychologists, we have psychomotor therapy, and we have running therapy.
wow.
There is a lot lifestyle interventions, and we work with sensorimotor psychotherapy, and we work with acceptance commitment therapy, and several other modalities. So I think having this rich team of people with knowledge and is quite unique. With so much experience, we work trauma informed. Everyone, is sensitive to what it means to have a background of trauma. Yeah. So what else is unique? I think the whole energy that we are, that we're putting into this, but also that we are showing people by, we greeting people at the door. We're very welcoming to people. We work from like a human to human. So there's, the clients feel that they are really seen. And then research, of course, but that's Rutger will talk more about that. But that's also very unique how we combine research and work, clinical work. Yeah.
And so when people come in, in the US, people are always envisioning, I don't mean like, oh, always like that's not anything. I mean, there are these grand visions of like, let's do all of these different multimodal therapies and, people can plug in and, but it's very difficult to get that off the ground. Like it's very, very, I mean, having been one of those people who, like thinks that's a grand idea, recognizing like the intersection of all of the different pieces clinically, and then how do different clients get funneled into different types of things, and how do they meet individualized needs? Like, how does that work?
Yeah, it actually works out it is a little bit of a challenge, but it's working out very well. Luckily, we have someone working who's very good at the plan because it just also boils down to how do you plan it? Like, just one client will do one group and one other another, but they'll have the same therapist, individual therapy. And you don't want clients to have to come in 5 times a week,
right?
So we're trying to kind of have people come in 2 or 3 days a week, and not have one appointment at 9 and one at 4. So there's a lot of these little. Me talking about it. This is our daily work now to try to figure all this out. But we have a program, and people go through the program, and it's individualized, but we also have a program because we also really believe in that certain things fit well together. Yeah. So, but your question was, the multidisciplinary. Yeah, and I think, it takes a lot of, not just because now we're talking a little bit about the practical side of it, but it also takes a lot of attunement for the therapists, because when a client does one thing with one therapist and then goes to the next, there's a lot of things that can happen in between. So we have 2 times a week a multidisciplinary team meeting, where we talk about like how the client is moving through the different therapies and what we are observing and what we are experiencing. But it really takes teamwork. You can,
I mean, that's incredible. So what I'm hearing is you're focusing on the team, you're focusing on what the individual clients need, but there are some core components like the running and obviously having a therapist and different things, because those are evidence-based. And what we all know, if you're paying, attention to that literature, is, that lifestyle and have a tremendous amount to do on mood and psychological symptoms and recovery from trauma.
Yeah.
So, so
maybe
Rutger, what would you like to add to that?
Yeah, maybe to add to that is that so I'm a huge fan of John Wise. He's a professor at Harvard in developmental psychology, and he developed a program called Match.
Yeah.
And it is basically starting from the assumption that you don't have a strict protocol that you run out, that you throw at clients and they're very strict with it, but that you, based on the diagnosis and the intake, you make a choice of different modules. So it's a modular approach, what he's proposing, really tailored to the needs of the individual client. It could be a young person, could be a family, could be or people that we treat. And I worked with him and I really liked that approach. And that's what we do. So basically we work with modules like Lego pieces that we put together. So it also means that some parts of the program are obligatory, but most of it is not. And then really based on the needs of the clients and the wishes and the professional judgments of people like Shiva, we developed this individualized treatment program.
Nice. So there's an academic piece and a research-based piece as well.
Yes. And second, it's important to say that it's intensive. So you can't come to us and just have one session, 1 hour per week. That's not what we offer. We offer an intensive program. So you really have to do the work outside and inside our clinic when you're here. So it is time consuming and intensive. And that's also a deliberate choice because we think that works for a specific group of people, clients, better than just very infrequently.
It's interesting because I specialize in trauma of all sorts, really primarily kind of developmental and relational. And you all know, because we've talked about this, but I think just this simple construct of expansion and contraction, that when, somebody's nervous system begins to expand, whether it's through running or psychotherapy or, CAP or, whatever that might be, the experience of therapist attunement. And then we go back into our lives, and our lives are holding up a mirror that the world is a scary place or the world is a challenging place or whatever that might be. It's difficult to sustain that expansion, right? And we go back into contraction. And that is very much a complaint of the once a week psychotherapy model. Like, how do we, that's a big piece with psychedelics, but it plays itself out in all psychotherapy arenas, in my opinion.
Yeah. And to add one thing that we haven't mentioned is that some of the Lego blocks, I like that idea, is group therapy. So it's also not just interacting with therapists of different kinds, but it's also learning from each other, supporting each other, or sometimes something difficult happening, with someone else, and that you can work that through in the therapy. So that's also a very important element.
Yeah. So Shiva, you mentioned attachment theory as being really important with that, and just working, I kind of take that and just, attachment wounding, which group psychotherapy is so great for that. So is that a piece of what you're doing?
Yeah. We don't really do the running and MBCT, and they are all in groups. So we have several groups, the Sensorimotor Psychotherapy group. So yeah, maybe I'm a bit very specific here, but I would not call it group psychotherapy.
Okay.
Because it is a little bit different, because it's more, I think it is therapy, of course, in a group, but it's very structured.
Yeah.
So people really learn skills and practice things.
Okay. So is it like a combination of like psychoeducation, skills-based, and then like the therapeutic component of it?
Exactly. Well, yeah, you put it better than I do. Yeah.
Well, I am sitting here so I really want to talk about the research pieces and some of the development pieces, but I'm sitting here dying to know how you get that paid for, because that's the huge question that I'm even sitting here being like, oh my God, that's so amazing. How would anybody pay for all that? And I know because I've been cheering you on that's been a huge piece of this. So let's talk about that. I know it's different in the Netherlands than in the United States, but you've had to go through a lot to get to that point. So what can you share with us about that would be helpful for people to understand?
Yeah, so the as you probably know, as comparable to Canada, we have a social healthcare system. So in principle, everybody it has health insurance coverage. And also for mental health issues. So in principle, when you get referred by a specialist or by a GP, you have the right to get psychotherapy. So that's one thing. Of course, there are waiting lists, and it's really hard. And the health insurance is not covering everything. But compared to the US, it's completely different, because in your country, way more people pay out of pocket, or you have clinicians that only accept out of pocket and no health insurance. We work 99% through health insurance.
And is this multimodal? Sorry, go ahead.
No, so that has its benefits, of course, because it means that healthcare is accessible for people.
Yeah.
On the other hand, people have to pay extra money out of pocket to complement the health insurance coverage, but still it's way more accessible in our system than in yours.
And does your healthcare cover I guess the question is do the things like your running groups and some of these more multimodal lifestyle pieces, and you mentioned nutrition and things like that, do those also then just count under the psychotherapy umbrella? And are you able to bill for that because of the evidence-based parts? And did you have to make a case for that with the government? Did you have to sell them on this model? That would be either one of you, really, whoever wants to answer that.
To be really honest, the conversations we had with health insurance companies is that they really get it. They really get the idea that a holistic approach is more beneficial, and not only focusing on symptom reduction, of giving them meds, but also to have this, to look at somebody's functioning in a more holistic, with a holistic lens rather than just focusing on the psychiatric part of. So that's acknowledged, but then financing that is a different that's a different
Right.
chapter, and that needs. So it's good to know that in our clinic only registered clinicians work.
Yeah.
So that's the one that's needed to get health insurance coverage, of course, and the elements that the modules are evidence-based.
So I want to, I keep saying I want to get to the data-driven piece because I know that's a huge piece of what you're doing, but let's talk about how CAP might fit into that. And then
Yeah.
let's talk about the data piece, and then maybe we can loop back to the CAP piece. So
Start.
yeah, go ahead.
So we were talking about the Lego pieces, and CAP is one of those pieces. So first of all, the CAP is a piece that you cannot do standalone. So we're saying if you want to do and come and do CAP with us, you have to do a part of the program afterwards as well. Because we find it super important that after the CAP, that people have plenty of time to integrate and also to work on all the other things that we just talked about. And we think that after, and we are researching, but we will say more about that. But we are quite convinced that people will benefit more from the therapies after doing CAP.
Yeah.
And the CAP is, well, as you know, we've learned a lot from you, Sandy and Signe, but there's a therapist always present. So it's not just ketamine, but it really is ketamine-assisted psychotherapy. So the client gets the ketamine, and the therapist is there during the whole session, active, supporting, doing everything that is needed. And then the client will stay with that therapist for a couple of sessions afterward as well. And then he or she will follow the whole program.
I love that. So for you all, CAP, and I think everybody knows what that's, ketamine-assisted psychotherapy, is not a standalone thing. It fits, that leads with this multidisciplinary clinical model, and then CAP will fit into that. So, but it's not, but this kind of wraparound is the primary modality, and CAP then becomes one of the tools that's designed to strengthen the rest of that. Is that accurate?
Exactly.
Right? I mean, I think that is so amazing because we have people, come in for CAP. And, I'm kind of consistently saying, like, if you follow certain lifestyle strategies, and including health and wellness and, exercise and social interaction and social connection, and we work on the relationship piece and becoming safe with that. If you do these things outside of this session, then I think it's pretty likely that you're going to have a much better outcome. And some people do, and some people don't. It's just so separated often, like as if somebody's going to come into me and I'm going to like fix them. And really, it needs more active involvement. So I love that. Yeah. So we can revisit that piece, but I really know that from the bottom up, it's been focused on data-driven, evidence-based practice, the incorporation of research. So let's talk about how that kind of, if somebody's wanting to build a clinic from the bottom up that is data-driven and incorporates research, because what I know to be true is that that's a quality control issue, that you can keep looking at what you're doing and make adjustments accordingly. So it's a clinically relevant, and it also then helps sell the business. So, let's talk about it from those perspectives as well as just the publishable data piece.
Yeah,
so Rutger, you want to start with that?
Yeah, the main reason why we are next to a clinical center, also our research and development center, is because we want to optimize treatments. So for in many cases, it's just a black box, and you don't know what's really happening during the treatment, and then you have some kind of outcome. And because we started it from scratch, we could design the whole data collection in a way that is that fits our needs and fit the needs of the clients. And So we call it, we have a client monitoring system that we set up, and that is an integral part of the treatment. So we don't call it research. We call that part just client monitoring, which basically every clinic should do to see how their clients progress through their treatments.
Yeah.
And it has different parts. And so one part is just the electronic health record system that we have and that we optimize for extracting data. We collect, we have a completely automated tool for collect survey data, so questionnaire data, like standardized instruments for in clients or their loved ones, but also therapists. And we follow also the clients after they leave our clinic. We start after the summer with ecologically momentary assessments. So people get an app. They download an app on their phone, and they once or twice a day they get a few questions about how they're doing. So
Interesting.
so we get more insights in how people are doing outside of the clinic when they're here.
Yeah.
And fourth is what we definitely will do, and we talked about it this week with one of the suppliers, is to use kind of people's iPhone, the Fitbits, Oura Ring to collect data from people about activity and about stress levels. And I mean, it's not easy. But if you, I think it's really worthwhile to know how people's stress levels, how activity levels are when we are not seeing them. So these are the four sources of data that we focusing on right now. And then, of course, once you collect all those kind of data, we will use AI to develop algorithms so that we can optimize treatments, can say after 1 or 2 weeks, hey, this is, and we can give clients or a therapist feedback on how the client is doing after 1, 2, 3 weeks. So you can discuss that with your client and basically say, hey, shall we change? So we make some changes to the program.
Interesting. So people in the US are really resistant to that. And I'm super curious about that because to me, once you have a methodology, and I know that is something that you've, been involved with, Rutger, is developing such a methodology that could be, moved and applied in different domains. It's not that hard and clients actually like it. Like they like the data. And I've always wondered, so much of the private sector in the United States is against doing this data-driven approach. It's too hard. It's not a benefit. It's going to cost us money, but what is the point? And to me, that seems like clients would be hungry for it and funders would be hungry for it and therapists would be able to use it. So is that a cultural difference or do you have thoughts about that?
I don't know whether it's a cultural difference. I think
is it just a business thing?
Many clinicians in mental health care in the Netherlands are also not really fond of collecting a lot of data.
Yeah.
I think it helps that we said to our team, we recruited everybody, we handpicked everybody. So we said, hey, this is where
This
you
is what
sign
we're
up
doing.
for. This is
If you
part of
like
what we
it,
do.
yeah.
And second, from an ethical point of view, I think it's important to evaluate whether your therapy is actually effective.
Yeah.
And for instance, whether the cap has an additional effect for some people compared to the regular program. So all these kind of questions about effectiveness and working mechanisms are important so our aim is not only to publish it, but also to share it with others.
Right. Yeah. Well, and it makes sense if you're requiring them to be involved in doing this as the whole program. If you're requiring them to be involved in the whole program first, then you can really actually look at what the additive value of the cap is because you're going to have a baseline by where they're starting, which is brilliant.
Yeah, and that kind of information is not only academically interesting, but also it helps you as a company because simply you can show effectiveness.
Totally.
And health insurance companies are interested in effectiveness. And not only in my country, also in your country.
Yeah. Oh, very much so. I mean, there's these like movements towards that. And, the private practice clinicians are like, what? What am I supposed to do? It's just almost like largely ignored. And I think it's a great business opportunity for practices and clinics to get on board with that, because then they can also withstand scrutiny for regulation and sell their programs better and improve their program. So Shiva, you're more on the clinical side. What are your thoughts about how that works out? The data-driven piece and the questionnaires and getting the clients to do it. And for you as a clinician, and is it a lot of extra work? Is it seamless? Does it fit in? How is that for you?
Well, it definitely fits in. I'm super excited about it because I've worked before at departments that were also doing research, but it was never really integrated.
Yeah.
So there was a lot of sighing and about lists and so now to have a team who's actually really into this, and we have a lot of PhD people with PhDs in our team, so we have quite a high academic level. So that is really exciting, and yeah, of course, it's a little bit of extra work. I have to think about one more thing that I have to do.
Yeah.
But yeah, in the whole scheme of all the things that you have to do, yeah, it's I don't feel that it's really difficult. No, I think it is exciting, and I really love the way that that has been thinking about this and how we that it really can tell clients we're really doing this also for you,
Good. I love
makes a big
that.
difference. Yeah.
Yeah. So let's switch back to the psychedelic lens then. So tell us about, you've already mentioned CAP and how you think it'll strengthen, but why CAP or why psychedelics? Like, well, how do you see that as being value added? Like, what is the value of, again, you're using ketamine-assisted psychotherapy. That's what we use because where we are, that's what's legal. And there's a lot of reasons for it. I also, as I've made clear in many other, podcasts, I love it. I've come to love CAP. I think it's extremely, useful in a clinical practice. So, why are you using that? Like, what's the draw to that? Because it would be easy enough to leave it out, right? That's like one of the, tricky pieces from what I understand. So, Shiva, you want to start?
Sure. So I don't think your question is so much why ketamine and why not another psychedelic, because I
Right.
think
Let's just
that's
stay with
clear.
ketamine because that's
That
what
is
you're
clear.
doing. And that's a
Exactly.
whole nother discussion.
I think it's time to, it's important to do new things, to try new things in mental health. And there are a lot of, nice initiative and new things. And this is one of them. And I think it's important to everything that we can do that can be helpful, we should try. And now we're doing more than just trying, because there's also a lot of research on that it's actually helpful.
Yeah.
And my experience is that it's helpful. And why? Yeah, I think it is a beautiful way for people to experience something that they can't experience just in ordinary state talking to someone. So to have an experience that is also really from within, it has not so much to do with the therapist or with what, it is really something that comes from within. It's an experience that the person has. It's very personal. It's different for everyone. And yeah, hopefully get in touch with something, the inside yourself that you feel, okay, I can, this is something I can work with, that I can continue working with. So it's definitely not that I think, oh, this is the solution. Whatever therapy form you do, whether it's psychedelics or hypnotherapy or CBT or whatever, it's always work. You have to work yourself.
Good point.
And
thanks for highlighting that. People think it's like this one and done thing.
Yeah, there's no way around that.
Yeah.
But I think this is a very helpful way and a very direct way.
Nice.
That also means that, that it can go faster.
Yeah.
Therapy just goes faster, I think.
Right. So, Rutger, what do you think? Why CAP? Why push the rock up the hill for the cap, for the add-on?
Yeah. So to be really honest, when I started to read about it and hear about it, not even so long ago, I was rather critical about it.
Right. I can see that in you.
And but I started to change once I really dived into the clinical trials and
Yeah.
work on the underlying mechanisms, and talking with clinicians like you, and talking with clients. I really then I started to shift. Like Shiva is saying, I don't think it's a holy grail. In our country, it's highly regulated, so we can't. It is primarily for people with treatment-resistant depression who already tried several other types of treatments, and we follow the clinical guidelines of care, and that's so it's not for everybody, but I think for a group of people that basically are undergoing all kind of treatments for relatively long, some for a long time, some short, but some often very long time. It might work out for them.
Great. Yeah. So so you all are doing, again, this comprehensive clinical model and with CAP being a piece of it, but let's talk about training. How do you get good at this? I'm aware of the fact that you obviously came through the Living Medicine Institute training, but you also did training with Polaris and others. And, what do you recommend, to people who want to get into the CAP field or are interested in this kind of, broader clinical approach? And then, what is there to know about the differences in this field in Europe versus the US? We can just kind of spend the rest of the time in those areas and whatever else we want to talk about.
Yeah, I think the situation in the US is completely different than here. So there are way more clinics that work with ketamine, all kind of administration routes. So that is completely different here. So here there are academic clinics working with ketamine in a research context, like clinical trials. But really in clinical practice, there are only a few. And you see that in different countries in Europe too. It's not as widespread as in Canada or in the US, for sure. And it also means for training is that there are not so many training opportunities. So we have the Mind Group in Berlin that are providing extensive training. The Open Foundation in the Netherlands just started a program. I think it's a 2-year intensive program for registered clinicians. So basically, there is not so much here in terms of training opportunity, except if you go underground. There are all kind of training possibilities in the more underground scene. But if you don't want to do it, you have to. But there are a few possibilities, but there is a reason we went to the US.
Yeah. Yeah. Why is there so few? Like I went and did the MAPS training in Sarajevo for MDMA and was kind of surprised. I was like, oh yeah, ketamine-assisted psychotherapy. And people are like, what? Or no, you can't do that here, was a lot of my, and yet, it's on the UN list of essential medicines. And so it's obviously available. So what's the difference? Cultural, regulatory, reimbursement, all of the above?
Yeah, number 2 and 3, I think, mostly.
Yeah. So people there's a regulatory. Oh, okay.
Yeah.
Okay. And the reimbursement piece.
Yeah. And I think I want to say, if you want to become a good psychedelic therapist, or become a good therapist, that is kind of key. Don't treat or do anything with psychedelics that you wouldn't do without.
So say more about that, because in the United States, there is no regulation that training is required. There is no, many people do it without even a recommendation that they get additional training. And then we've also got this idea that the psychedelics themselves are the thing that are going to do it. Like if I just come in and do ketamine a few times, then I'm fixed, I'm cured. And what you're saying is what we believe, that you have to be a good therapist first, and you have to do ethical and do it well. So, do you experience the same thing in your world, or, what are your thoughts about that?
Well, I guess in some ways regulations are also good. So here, in the mental health field, you won't, you have to be a registered therapist before you can do anything else. But in the underground, of course, you see all kinds of things and you see beautiful work. But there is, I think, sometimes a tendency to think like if you've experienced psychedelics and then done some training in psychedelics, that then that's enough.
Hmm.
And I don't, yeah, that's not always the case. I think it's good to be a therapist of some kind. There are a lot of different types of therapists, but to have like good training.
Hmm.
Also because it is, especially if you work with people who are really struggling mentally. I mean, it's different, of
Yeah.
course, if it's a friend who, is stable and healthy and you sometimes
Right.
sit and hold her hand while she is tripping. That's a whole different. But if we're
It
talking
is a
about,
whole different thing.
yeah, it's a
Right.
whole different. I'm not talking about that, of course. But if I talk about people with trauma, with depression, with attachment trauma, shock trauma, yeah, you need to know what you're doing, I think, and or
Hmm.
at least, I'm not saying that I always, but that it's never 100% that but at least to have a good base, you know.
Hmm. Hmm.
Yeah. So yeah, I want to take a little bit away the focus on the psychedelic being some kind of magic something.
Hmm.
The therapy is also really important afterwards and
Yeah.
during.
Yeah.
Yeah,
Great. Thanks. Rutger,
yeah.
what are your thoughts on that? How important is training? What's a good training program?
Yeah, I
From.
think it's essential. So what I find really interesting, that's an observation of me, is that many people that use psychedelics in a retreat context, they have such a powerful experience. They are convinced that they need to help other people going through the same
Mm,
process. And I think that experience is more profound with psychedelics than with other types of therapies. So
right.
the inclination of people to really help others, and that's
Yeah.
the reason that I think that many non-trained um, participants of retreats start to look into opportunities to coach people. And in our country, you can psilocybin truffles are legal, so you can basically use that and set up your own
Hmm.
practice.
Yeah.
Um, and especially in the case of people, if you work with people with severe mental health issues, I think that's not the way to go. So we
Right.
want to work we completely conform to the regulatory guidelines, to the system we are working with, also because we work with people who have severe issues. And I
Yeah.
think, and that's my worry about this field.
Mhm.
And that's also
Yeah.
why it's very important to have really good training
Yeah.
and make it obligatory.
Well, I agree with that. And that's a really important distinction. And then I just, in the last minute, just want to ask you what keeps you excited about all this. And I just want to name that for everybody. Like there's a therapeutic experience and there's a therapy experience. And you can have a therapeutic experience that is life altering. And it can be facilitated or held or in nature on your own. And that is not psychotherapy. But that doesn't mean this can't be life changing. But some people have more complex needs and really need psychotherapy. And
Yeah,
it's really important that we as a field continue to focus on that scope of practice and that differentiation, because we have to also educate the people who are suffering or who are looking for, and help them kind of track what it is that they're looking to achieve. So thank you for bringing that piece up. I think that's so important.
yeah.
So last question for each one of you, just in the last couple minutes here, is what keeps you in this? This is a tremendous amount of work, right? There's like, of course, we wish to be successful in business and all of that, but like, what is it really like? Shiva, you want to start? Like, what has got you most excited about what you're doing in this moment?
Yeah, I'm very excited about our team. Yeah, I
Yeah.
think, and both our management team, Rutger and Carlijn, and the working together and setting this up, but the team who are actually doing the day-to-day work with the clients and with the love and attention they do that. That makes me very excited and and touched. Yeah.
What an incredible opportunity. It must just be so amazing. So how about you, Rutger? What keeps you excited about this? Why are you pushing this rock up this hill?
Yeah, sometimes I wonder.
I know, right?
No,
but like you keep coming back. You've done like a complete pivot of your career into all this direction.
Yeah, and
so,
it's the I mean, one of the main reasons I thought it was a good idea to set a clinic rather than studying as an academic on how other people are setting up clinics or running clinics or running treatment programs is that is by having full control over all parts of the treatment and also the administrative processes, we are able, I think, to implement a model that might be really setting a new standard. That is these are big words. These are big words, I know.
Right.
But you have to dream, right? So that's my dream. And because we collect all the data, we can also draw this kind of conclusions. Not now, not in the next months, but I think in 18 months, we have sufficient data to get out to the world and say, hey, this is an approach and maybe you can learn from it.
I think it's amazing. I mean, I think you're doing it so well and right and with ethics and attention to all the details and the right people. So I just really want to applaud you all. I think it's amazing and I'm happy to know you and I'm inspired by what you're doing. And so people can find, is it senz.com, senz.com, or is there a different website that people could find out more about what you're doing? Shiva?
Yes, for sure.
What would be the website?
I'm thinking, oh my God, is it senz.com or is it senz?
I don't know what it is. So I'm just trying to if people are listening and they want to be like, let me learn more about that. How would they find that out?
I had a little blank there.
It's okay. Rutger, do you know?
Yeah, it's Senz, so SANZG.
SAOC. This is all like different language.
But maybe we can put it somewhere because it's and second, our website is also completely in English, so you can.
Oh, okay, great.
It's in Dutch and in English, so because we treat clients also who just don't speak Dutch.
Good. All right. Well, thank you both so much. I really appreciate it, and thank you so much for your time, and thank you for being here. And I'm just grateful. Thank you.
Thanks. Sandy.
Thanks for listening to Living Medicine. We'll see you again next time. Be sure to click subscribe to get future episodes.